asked me questions about pigmentation around the mouth, which is extremely common in us people with skin of color. I also have a slight bit of a pigmentary demarcation line, which I've always had ever since I was growing up. And so it's really common. So let's talk about why it happens, what you can do to control it. So let's get started. I'm Dr. Tanvi Vaidya. I'm a consultant dermatologist and we're going to be breaking down perioral pigmentation today. Now, why does perioral pigmentation happen? The most common cause, I would say, is dryness. Every time our skin gets dry, this is a very common area that gets drier than the rest of your face and it starts looking darker. The next most common cause is just lip licking. So every time you lick your lips, it's the saliva coming in contact with your lips or the skin around your lips is going to set up a little bit of an inflammatory reaction that's called lip cheilitis. That's going to darken your lips or even sometimes make your lips look a little white. And the skin around it starts looking grayish and darker. So it's also the kind of thing that, when I tell patients that you actually have lip cheilitis, a lot of people tell me that I don't even lick my lips. Like, what are you talking about? I don't even lick my lips. But they do. They're sitting in front of me and they lick it 5 times during one consultation. So most of us actually don't realize that we're licking our lips so much. So definitely get someone around you to check if you're actually licking your lips. That's number one. Second most common reason of perioral pigmentation is sometimes an allergic contact dermatitis. So our toothpastes, cosmetics, just our saliva coming in contact with that skin sets up an inflammatory reaction in the skin and it leaves a post-inflammatory pigmentation in the skin around our mouth. So make sure it's none of that. Make sure you wash your face after you rinse your mouth when you brush so this toothpaste isn't coming in contact with your skin. Make sure you're not using products that don't suit your skin. If your products that you're using are causing any amount of burning or sensitivity, that could be an allergic reaction. So definitely work on that. Another really common cause of pigmentation here is seborrheic dermatitis. So seborrheic dermatitis is like dandruff on your face. The way you get dandruff on your scalp, you can have dandruff on your face. Like the sides of your nose, it can get really scaly. It can get really scaly here at the corners of your mouth and then it can cause pigmentation there. Similarly, behind the ears, upper chest, upper back. These are really common areas of seborrheic dermatitis. And typically, if you have a lot of scaling happening here and a lot of dryness in this fold or in this fold, it could be seborrheic dermatitis and you need antifungals to treat this condition. So definitely talk to a dermatologist. Other common causes are deficiencies, like a B12 deficiency is very common in causing a perioral pigmentation. Sometimes drug-induced hyperpigmentation can happen in this area. Sometimes certain medicines can cause a pigmentation around the mouth. So drug-induced hyperpigmentation can happen. Some hormonal conditions like thyroid, Addison's disease, sometimes even just a PCOS and insulin resistance can cause a pigmentation around your mouth. Another common cause is PDLs, what I said I have, pigmentary demarcation lines. I have them here as well as here. Pigmentary demarcation lines are genetic. You're probably born with them. They worsen after puberty. They worsen when there's sun exposure. They worsen when there's a lot of stress in your life. It happens because the melanocytes, the pigment producing cells, have migrated in a particular way. So you have naturally this demarcation line. You can keep this line in check by using depigmenting creams, sun protection, sunscreen, certain procedures can be done to keep these PDLs in check. I myself do laser tonings almost every month. I wear sunscreens every single day. I wear a lot of depigmenting creams on a regular basis to keep my PDLs in check because I'm massively prone to having these pigmentary lines on my face. Lastly, of course, pigmentary conditions like melasma can sometimes develop around your mouth. So melasma need not always be here. You can also get patches on your chin or around your mouth, which can also be just part of your basic pigmentary issue. Now, how can you go about treating it? So as I said, first of all, start identifying why it's happening. A lot of people just ask me, I have pigmentation around my mouth, what should I do? You need to first figure out why it's happening. So all of these things that I listed above, try to figure out if any of them are applying to you. Have you done your blood test? Have you checked your B12 levels? Are you making sure you're washing your toothpaste off properly? It's not like an allergic reaction. There's no seborrheic dermatitis. All of these things that I mentioned above, please make sure you're checking. If you're ensuring that all of these things are clear and you don't have any of these issues, then we can talk about plain and simple depigmentation. So of course, sun protection every single day. Any pigmentation anywhere on your body, the most common thing worsening it is your sun exposure. So wear sunscreens every single day, reapply once more in the afternoon. Make sure skin is super moisturized because just the dryness itself can really worsen this pigmentation. So make sure skin is really moisturized. Next, depigmenting creams. So creams containing ingredients like kojic acid, tranexamic acid, azelaic acid, arbutin, licorice extracts, all of these really work well to depigment the skin. I don't want to give out prescription product recommendations in this video. There are hydroquinone-based creams, retinol-based creams, which are stronger and can be used to depigment, but I don't want to talk about this because I've seen a lot of people just watch stuff on Instagram or YouTube and start using it, and then it damages their barrier and it makes the issue worse. So for stuff like that, definitely you have to consult a dermatologist, and only then we'll be giving you prescriptions with such creams. But when you want to try this out at home, you want to do it on your own without consulting a dermatologist, here's some OTC-based products that you can start using. I'd say use a vitamin C or a niacinamide-based serum in the morning, followed by a moisturizer and a sunscreen. Linking recommendations here. And at night, you can use plain depigmenting products. Again, linking some recommendations here. Whenever you're using these depigmenting products, please remember to moisturize after using these products, because all of these will have some amount of exfoliants which will make your dryness worse. So you have to moisturize after using such products. Other than this, there are also in-clinic procedures that can be done. For example, basic chemical peels. Laser toning is one of my most favorite procedures to work on perioral pigmentation. For myself as well, for my PDLs, laser toning is what I regularly do. Skin boosters is something that works extremely well because very often this is linked to a dryness component that is happening in the skin. So skin boosters really help to amp up that hydration and really work on that perioral pigmentation. There's also microneedling with tranexamic acid that works extremely well on perioral pigmentation. So that's another procedure that you can consider trying. I hope this video is answering a lot of your questions. I hope some of you have been able to figure out why this is happening, and I hope this video helps you to get rid of it. If you have any questions, please ask me in the comments, and please don't forget to subscribe, like, share, all that. Bye-bye.